Today on Full Circle, we are speaking with someone whose work sits at the intersection of compassion, community, and care. Lindsay Kratzer is the founder and owner of Reflections Management and Care, a company devoted to helping seniors and their families navigate the complex journey of aging with dignity, clarity, and support. With a background in psychology and gerontology, it brings over 20 years of experience to the table. She is a certified dementia practitioner, a certified care manager, a certified transition relocation specialist. But beyond the credentials, it's her heart led leadership that truly stands out. From launching a memory cafe to founding the CNY chapter of the Case Management Society of America, Lindsay's work is driven by deep personal passion and grounded in community impact. Inspired by her bond with her grandparents, she's made it her life's work to ensure others receive the kind of care and respect we'd all want for our own loved ones. Lindsay, welcome to Full Circle. We are so glad to have you. Would love to kind of start off with what brought you into elder care. I know you spent more than a decade in the space, but would love to understand how you got into senior care. What was the motivation? How did that happen, sort of a thing?
Yeah, absolutely. It's actually been over 2 decades, believe it or not.
Yeah.
I've always been in the helping profession. I think the thread that's connected to every stage of my career, my passion for working with older adults, it really sparked early on when I was younger with the close relationship I had with my grandparents. I really didn't realize it then. Hindsight is like, okay, this is really where this is coming from. But my grandparents' influence was just profound. And it gave me a more personal understanding of the dignity, challenges, and just emotional complexity that's involved with aging. So that connection inspired me to pursue the path that I'm on right now and ultimately make a meaningful difference. That's the key, is making that meaningful difference within the seniors' lives, families. I have a background in psychology, specializing in counseling, and also my certificate in gerontology. And then fast forward, I'm a certified care manager, certified dementia practitioner. And I saw how vital it was to have someone guiding families through all of these difficult decisions when it comes to aging. Aging life care became just the perfect way to blend my professional expertise with my heart for this type of service. Helping people feel supported, seen, and empowered really, really is what drives me and motivates me.
Understood. Understood. No, I've seen that this is actually a recurring theme among a lot of people who get into senior care. They are inspired by their grandparents. They're very attached to them. Probably get some thoughts and stories from that. You mentioned about your experience in the previous conversation, Lindsay. You're an entrepreneur now, right? You're running Reflections. Would love to kind of understand. I mean, I understand the inspiration for that, but what specific gap were you trying to fill? Where did you see the opportunity to improve the elder care market was, and so on and so forth? So talk me through a little bit of that.
There's so many gaps. Healthcare in general is extremely complicated. And a lot of times folks are not, I shouldn't say a lot, the majority of folks we come across are not pre-planning. We always say we have time, we have time. Time is very short. And getting your wishes across to your loved ones and making sure that they're followed is so very important. So there's been a lot of gaps within home care, whether it's affording home care, insurance, it could be even the smallest little things, especially, where we're located, it's highly regulated. The healthcare system is highly regulated. So really trying to figure out what is the most creative solution within our means to try and promote this independence. Yes, with my grandparents, they were the guiding light. They went through their own health challenges. They went through their own, ups and downs. And I saw both of my parents, go through all of those emotions. And, when I started Reflections, it was right in the midst of COVID.
Wow.
It was, again, with those gaps, hearing people, hearing families, hearing clients so unsure, like the rest of the world was, I knew I could make a bigger impact. So families that needed trustworthy guidance between that and holistic planning, and someone who truly saw the whole person. not just a diagnosis. I wanted to build a company that empowered seniors and their families while honoring their wishes and dignity. It's, just to go back to my parents and my grandparents, just watching my grandparents maintain their independence while needing some more support. How was that going to look? There was a lot of resistance. There is always a lot of resistance because it's that control and that independence. You definitely, and then there's cognitive changes as well. So just seeing that really, again, inspired me to start putting all of these pieces together and bring this holistic approach to senior care.
Got it. So, Lindsay, actually, and I've seen this in very close quarters with my own grandparents and others. I think there is resistance both from both sides, right? So, for example, my grandfather was very keen on being independent, staying all by his own, but my parents were not comfortable letting him do that when he was 94, 95, right? So they were very keen on making sure that, so there is resistance on both sides. So I'm sure there's a lot of negotiation and intermediation that you do as part of your work. I would love to get into more about that, but before that, Lindsay, you mentioned about how people don't plan for the demise, or whatever is the kindest word to use on that behalf. How have you gone about that? Like, are you seeing things change? Where do people actually realize that, hey, I'm probably going to be on this earth for 80 years, I should be planning about what happens from my 75th year onwards? So tell me a little bit about that, how your experience on that has been.
Well, typically when we get the phone calls, it's during crisis and people are panicking because all of a sudden they realize there is not time and maybe their loved one does not have the capacity at that moment to make these decisions. So folks, families, there's a lot of guilt, a lot of hesitation because they want to make sure that they're doing the right thing. So just getting the word out and providing that education, providing seminars or, events to support caregivers and families and let them know that, listen, you need to do this now. And we even encourage clients that can make those decisions right now to say, do your loved ones know what your wishes are? Do your loved ones know where to find this information? Because if something does happen, they want to follow those wishes, but at the same time, if something is temporary, if there's just a small emergency, at least we know the wishes and we can advocate for those things. You're still in control, right? You are the one ultimately that made those decisions. So it's really about education and having those discussions with anyone that comes our way.
Do you see, like, as you said, people kind of pick this up during a crisis? Do you see their children actually getting more cognizant about it and doing some planning, or is this a loop that is kind of, what should I say, vicious in its own way?
Well, I think this is the perfect example of families do see that their loved ones might be declining physically, emotionally, cognitively. And families try to have those conversations with their loved ones. And again, there's the resistance. So typically when we get the phone calls for our loved ones to help, there's a stigma about this. Oh, mom's never going to let anybody in the home. She's telling me no. And really the conversation that we have is, at the end of the day, bring the professional in. Bring the professional in, the third party. We can talk about all of these aspects and bring you involved because, again, a lot of the hesitation is this fear of talking about death, the fear of talking about an emergency. People don't want to think about these things. So, just letting them know that, bring in the professional, bring in the aging life care manager, someone who specializes in the senior population to show what the options are. And it tends to open up the conversation more with the families. The families will usually say, wow, I didn't even think you'd get through the door. And a lot of it is, again, you're putting that senior, the one that is aging, in control of the situation. And you're letting them know their options and kind of giving them an eye opener on what potentially could come. I always say plan for the worst and hope for the best.
Understood. Oh yeah, so I can imagine that there are scenarios drawn out depending on how the demise happens, the death happens, and all of those things. So wow, it's very nuanced in that sense. Lindsay, are you seeing a lot more people actually opt in for this kind of counseling? Is this a market that is taking off? Are you seeing people being more cognizant of it, or has this not changed significantly in the past 2 decades that you've been in the space?
There definitely has been movement, especially in the last, 10 years. Families, the traditional family that folks saw many, many years ago, families don't live close to each other. And a lot of times live across the country, might even live 3 hours away. But still, it's hard for the children to manage something like this. And if they're somewhere else in the world,
Yeah.
again, rules are not necessarily the same. Healthcare is not typically, the same model state to state. So that's where we come in with those resources. We could have a family member in California and mom is in New York. She doesn't want to move closer to her family. So we will put that safety net in and we will have that communication with the family to say, hey, mom, this is what's going on with mom today. Everything's great. We might want to change a few things on the care plan because this is what we're seeing. But if there is an emergency, we're also there. They don't have to panic and say, I've got to catch a flight. I've got to go there for mom. And it allows the families to be family and not the caretaker because it is a huge stress and burden.
I can literally put myself in the position of a child and figure out how useful that service is, right? I think this is something that I'm constantly worried about from my parents' perspective.
Yeah, and we have families that will just say, "Listen, mom's going to be resistant in paying. We'll pay for your services just to give us that peace of mind."
Yeah.
So, we see a lot of different things, but there definitely has been momentum. And I think a lot of the momentum is that professions like us are becoming, more known, but also there is so much illness that is going on. And like I said, the healthcare system is very complicated. Folks that are going to the hospital multiple times in a month, that's where we step in and we advocate for the population we serve. We don't want them to go to the hospital.
Yeah.
If we can prevent that, absolutely. But again, it gives families the peace of mind, and people are really starting to see the value of the aging life care profession.
So tell me a little bit more about that, Lindsay. You mentioned that you don't want them to go to the hospital. So what are the kind of things that you end up doing to kind of prevent, reduce the level of hospitalization and all of those things? Some examples maybe?
Yeah, so we always complete an assessment. And there's a generic template, right, for an assessment, but ultimately every assessment that we complete and care plan is very personalized to that client. So when we do the assessment, we look at the physical, emotional, all these things. How are they currently functioning, and where could some improvement be to promote that independence? So it could be a matter of making referrals to physical therapists, making referrals to additional specialists. It could be we found out that they don't have their pre-planning in place, so referring them to an appropriate estate attorney to get those documents completed. So it's getting additional services in, whether that's a service that they're entitled to, whether it's veterans benefits or maybe it's a service through the county. But then we look at additional supports to provide, whether it's the acts of daily living or activities of daily living or more of the other functions. How are they functioning? Are they getting out into the community? We're trying to prevent that, isolation as well. Some clients, it might be a little bit of everything. Other clients, it might just be one thing because they're doing great, but it comes down to that assessment, and we start to bring in the resources to promote the independence. And then we monitor, how are these services going? Do we need to change, increase, look at a different model? But it's continuous. It's daily that we're keeping up with our clients.
And as I can imagine, this is not a cookie cutter approach. It has to be very, very specific to that individual, their health, their specific issues, and so on and so forth, right? And it is a continuous engagement. You're in touch with the parents and the elder and the children all throughout that engagement.
Right. And it's a team. It's a team approach, right? It's yes, the client and the family, but it's also any other professional that's involved with their care. And in having that communication and making sure all of the parts are working.
Lindsay, isn't the job extremely satisfying? Like, I'm sure you thank yourself every day for being in this profession, playing such a critical role in the life of some of these.
I've often been told you're crazy starting a business. And, some of that might be a little true.
Yeah, it is.
But at the end of the day, when you see the smiles, when you see family members' shoulders go from this to, oh gosh, I wish I would have known you, 10 years ago when we went through this with my other loved one, that makes all the difference. It's so rewarding. And to be honest with you, it's like I don't even own a business. I'm just doing, again, what my heart really enjoys.
Yeah.
It brings me a lot of joy.
Yeah, it's a passion turned into a business, right? Essentially, at the end of the day. So, Lindsay, moving on from that, tell me a little bit about Memory Cafe. I'm so intrigued by the idea. I would love to understand what you're doing over there for the audience. Go ahead.
Memory cafes around the country have started to become more popular. Specifically located where we're at, it's rural, where we are at. And again, it's the Memory Cafe. It's held once a month, and it's to provide a stigma-free environment for folks and their loved ones with cognitive changes, memory changes. And yes, it's an hour and a half, but anyone who has experienced a loved one with, a cognitive change, it can be very exhausting. And to get somebody out of the house who is starting to isolate themselves can be very challenging. So we try to bring not only resources to the Memory Cafe, but we also provide activities in, again, an environment that is stigma free. A lot of times folks in the community, even with us care managers will say, my loved one will put on a really good show, and it'll look as though, she knows what she's doing, but this is what's going on. Or I'm sorry they keep asking your name. You don't need to be sorry. This is our profession. This is a disease that we are working with and helping the families as well have some of that respite. So we decided that we're going to start this cafe and bring more community awareness and bring a safe place that folks can go for a short amount of time and feel some relief.
Good. And I'm sure this is one of the larger issues that a lot of elders have, like memory related problems, cognitive this thing. Is that a large share of most older adults? These cognitive issues sort of a thing?
To have an official diagnosis of dementia, Alzheimer's, yes, we see that frequently, but a lot of times we see age-related cognitive decline.
Got
And
it.
it is common with all of us as we age. Our mind is not as sharp as it used to be. So whether you have a diagnosis of Alzheimer's, dementia, Lewy body, whatever, still, there are folks that don't have this diagnosis that sometimes will forget things. And this is exactly what the Memory Cafe is geared towards, to be with like-minded people.
Got it.
But definitely we do for the most part we see folks with the cognitive changes.
Understood. Lindsay, you mentioned community also in the earlier conversation. What is the role that the community plays? How are you kind of bringing it together? I would love to talk about the Baldwinville Award as well in a bit, but maybe you can give me some context on all of this.
Direct care is so essential within the community, especially in the most rural areas that we potentially serve. But direct care is not, like I said, the whole picture. So, making the community, again, more aware, building those relationships. Older adults thrive when they feel like they've been seen, right? Valued, included. And the community support with anything that we do, it combats that isolation. That isolation that I keep bringing up is so detrimental to health, chronic illness, whether it's engagement, peer engagement with our Memory Cafe or neighbors checking in on one another, making the public, Baldwinsville and surrounding communities aware of the resources. It really provides these connections so folks have this sense of belonging and purpose. And sometimes it really hits home with folks as well, saying, I've been through something very similar. So they're able to share their stories and have other folks feel more comforted that they're not alone.
Got it. And I'm guessing there's a lot of hard work, like getting the community together, building that awareness, it's probably some amount of door-to-door conversations, it's probably group conversations. Like, how have you kind of, I mean, I know I'm getting tactical, but would love to understand, like, what kind of effort does it take to win the Baldwin Award, or to get the community kind of involved in something like this?
At the end of the day, it's building relationships. And again, I can speak personally on going through something very similar. But when someone in the community, it can be a professional, a colleague, a neighbor, whatever, comes to me, or even our team, it's not that we can't help. We might be able to provide a little bit of information that might help that person go in a direction that they didn't even see before. If it's a service that, we we're not a good fit, we don't we pass on additional resources. We don't just hang up the phone and say, sorry, we can't help. We provide the appropriate resources for folks to look for services. It's so very common and so very easy of all of us to Google something, right? Whether it be home care, whatever. But at the end of the day, if you don't know what you're looking for specifically, Google search is not going to bring up the information that you're looking for. So that's where giving us a call, having a conversation. We want to know you. We want to know who's referring to us and build those relationships. Even if you call and you engage in our services or don't even engage in our services, we want to fully understand the picture that is going on so we can provide, the most accurate information so folks can thrive.
So actually, Lindsay, interestingly, we were having a similar conversation earlier. A lot of times, I'm guessing when you spend time with a client, you don't know whether it's going to lead to a commercial engagement or not. You're just there to guide them. You might just end up referring them to somebody else and so on and so forth. I'm guessing. So again, I think this is a lot more passion and social work than this is actually a business in that sense, right? You can't get in saying, I will hang up the phone if I can't provide the service, sort of a thing. That's kind of been my observation as well. So, Lindsay, sorry, go ahead.
No, I was just going to say, it's driven a lot by passion. And, I have a wonderful team that has similar values that I do, but it's so very important to myself to these clients and understand, we all have different backgrounds, similar backgrounds, but very different experiences, which when we hear these stories from clients, we focus on what really is going on and assigning them to the most appropriate care manager. It's so very important. You have to really understand what they're going through. So it could be something as like maybe somebody with a traumatic brain injury or a history of stroke. There's a couple on our team that are really well versed in that or the resources. And of course we share these resources, but to have one who specializes in certain disciplines is so very important for care.
I'm sure. And I'm guessing it multiplies, right? The most time they spend with that particular cohort of elders, the better they kind of become at that. Just like how a doctor kind of functions.
Yes.
Switching gears a little bit, where are you seeing technology kind of take off? Where are you seeing that actually making either your life easy or the life of your patients or your partner sort of easy, sort of a thing? Tell me a little bit about the technology side of your work.
I mean, technology just in the last, I would say 5 years has come a significant way when it comes to enhancing safety, communication, and even care delivery. Tools as simple as medication reminders, GPS-enabled devices, so it could be a fault or maybe just a GPS device because maybe your loved one sometimes goes off the beaten path. And telehealth alone, it's made it a lot easier for families and clients and even providers to stay connected. And responsive. That's another thing. It's a lot. We're getting quicker responses.
Yeah.
So for many of our clients, these tools increase independence and peace of mind, especially for families. But I want to make it clear, technology isn't a replacement for human connection, right? So not all seniors are comfortable with digital platforms or cameras or fall detection, and systems are often designed without the older folks in mind. So there's still, I feel, a very long way to go in making technology accessible, intuitive, and inclusive, especially with those, with sensory impairments or cognitive changes. But overall, in the last 5 years, it really has promoted much more independence and a cost factor as well. Right? We might recommend a certain amount of hours per day for care, but there might be a piece of technology that might offset that recommendation in a safe manner. So families are very more apt to go for this technology, and even the folks that are clients because of cost.
And I couldn't agree more with what you said earlier, right? I think in most of healthcare, and I'm sure in this space specifically, technology is a great enabler, but it's not really a replacement for human touch, right? I think we are very far away, and I think that's very valid. Like most of tech is not built keeping elders in mind. It's kind of not very easy for them to use, so completely align with that part. Lindsay, we I want to touch on this earlier, but bring that back again now. Tell me a little bit about the Baldwinville Award that you won. Tell me how did you come about it? What does the award stand for, and so on and so forth.
First I was very blown away by that recognition, and just it really means a lot. So, I was nominated as the Baldwinsville Chamber Business Person of the Year. And at the end of the day, when I learned of who nominated me, it was even more meaningful. So, to be recognized, one, in the community was wonderful, but two, I think it really hit home when it was my mom. My mom had nominated
So
me,
nice.
and she, of course, didn't say a word to me about any of it, but it was because she, not only am I her daughter, and she, of course, is very proud of what I do, but in the last year especially, my mom has gone through so much. And to use my expertise in different situations and to be that sounding board, I think that she most definitely had much more understanding and respect for what I did. And it's at the end of the day, no matter if it's the cafe, if it's reflections care management, she saw the value in the service that I provide to the community, and it was just really, it was wonderful. It was wonderful.
That's so heartening to hear, Lindsay. I think what better than being able to serve your own parents with the expertise that you have, right? Like, so one of the reasons I've always been intrigued and interested in elder care is one, so that I can implement some of that for my own parents, my own grandparents, and hopefully some of that could help me when I grow older as well, that expertise. But yeah, it's awesome to hear all of that stuff, right? So glad to hear that, Lindsay. I think this has been a fantastic conversation. Wanted to ask you one piece of advice, or go on and talk as long as you want on this, for somebody who's in the process of caring for their aging parents or any older adults. What is the one thing that you would ask them to keep in mind? What is the one message you would like to leave them with, sort of a thing?
If you're starting to think that you need help, you're past that point, and you need to reach out for
Yeah.
help. That is number one thing that I can take away. If you're starting to feel overwhelmed and saying maybe I should consider, reach out to an aging life care professional, and they can help guide and steer you on what's available.
That's extremely precise and sharp. If you're thinking about help, you're already past the point. That's awesome. Lindsay,
Yeah.
thank you so much for this. This was fantastic. An absolute pleasure talking to you.